Welcome to another episode of FMGE Recall Rush. As you all know, you will be challenged with some crucial microbiology PYQs, which will benefit you in the upcoming FMGE exam. Drop your queries or feedback in the comments. Let's look at the first question from this video.
Question 1. The stain used for identifying Cryptococcus in the CSF sample is? Here are the options. A. Albert's stain. B. Silver staining. C. India ink stain. D. Rhodamine stain. And the correct options is C. India ink stain. Here is the explanation.
As a case of cryptococcal meningitis. Now, having said that, please remember cryptococcal meningitis is going to be diagnosed in 3-4 classical tests, some of which you already know if you've done the first part of this chapter. So please remember, if you have a patient of meningitis, the sample that you will be taking will be a CSF sample for obvious reasons. If you've taken a CSF sample, what is the testing that you prefer? There is a negative stain that we are going to do. When we say negative stain, what we get is India ink or nigrosin. What we get is India ink or another stain known as nigrosin. So you can see, right, that the background has got the color. The background has got the color and the capsule is unstained. The capsule has been highlighted. Capsule will not pick up the color. So capsule will be shining. So if the background has a color, the capsule will come out as highlighted. Okay.
Question 2. Which of the following dimorphic fungi causes subcutaneous mycosis? Here are the options. A. Sporothrix skenki. B. Histoplasma capsulatum. C. Blastomyces dermatitidis. D. Penicilliosis marnefi. And the correct options is A. Sporothrix skenki. Here is the explanation.
Then after the skin, we come down to the subcutaneous tissue. Subcutaneous tissue has MRCS. MRCS is one of the famous exams and the toughest exams that we have. So subcutaneous, what is MRCS? M is going to be for mycetoma. R is going to be for the very famous rhinosporidiosis. C is going to be for another very famous organism, that is chromoblastomycosis. And S is going to be for Sporothrix skenki or sporotrichosis. So what is MRCS? A quick recap. M stands for mycetoma, R stands for rhinosporidiosis, C is for chromoblastomycosis, and S is for sporotrichosis.
Question 3. Which among the following culture media is used in the identification of Salmonella typhi? Here are the options. A. PLET medium. B. BCY medium. C. Wilson and Blair medium. D. Stewart's medium. And the correct options is C. Wilson and Blair medium. Here is the explanation.
So this was same for Salmonella and Shigella, but you'll say, ma'am, there has to be a point where you differentiate between them. And this is the recent FMG as well as the NEET PG question, and that is the Wilson and Blair medium. So tell me, who created a fight between these two sisters? There's a boy named Wilson. He came and these two sisters ended up separating. Till now, everything they were together. Wilson and Blair came and created a problem. So remember, Wilson and Blair is something that you will see only for typhi, and typhi is gonna get jet black colonies like you see over here. So please note, Wilson and Blair medium is going to be for Salmonella typhi, and what you're going to get are gonna be the black colonies. Very important. So who created a fight between Salmonella Shigella sisters? It's the Wilson and Blair.
Question 4. A farmer presents with a swollen foot and multiple sinuses as shown in the below image. What is the most likely diagnosis? Here are the options. A. Mycetoma. B. Squamous cell carcinoma. C. Nocardia. D. Sporotrichosis. And the correct options is A. Mycetoma. Here is the explanation.
Now, I hope as soon as I say mycetoma, there's a very famous image that should be coming to your mind. That is the very famous Madura foot, or there's going to be a foot that will be given to you in the paper. Along with that, there will be multiple discharging sinuses. Multiple discharging sinuses. So we have got a schematic diagrammatic representation where you can see there's some yellow or brown pus kind of a material that is coming out. Basically, there's something to do with the discharge that is coming out.
Question 5. A farmer presents with a verticutaneous growth on his foot. Histopathological image of the growth is given below. Which of the following is the most likely diagnosis? Here are the options. A. Sporotrichosis, B. Mycetoma, C. Chromoblastomycosis, D. Phaeohyphomycosis. And the correct options is C. Chromoblastomycosis. Here is the explanation.
Chromoblastomycosis. Now let me first tell you the image and then I'll come down to the theory aspect. When I talk about chromoblastomycosis, there's another name given to chromoblastomycosis and that is verrucous dermatitis. Chromoblastomycosis is referred to as verrucous dermatitis, and what do I have to know about it? Dermatitis tells me that there is going to be a skin involvement. I can see a foot picture that has been given. So please remember, this is because of traumatic inoculation. So you will ask me that why is the patient having this kind of trauma? So these are usually forest workers. And you know why is the emphasis so much on forest workers? What is so different about forest workers than all of us? Because they tend to walk barefoot. So you will have the history of a forest worker. Most common question that comes, there's a forest worker who's walking barefoot, and because he's walking barefoot, there's a traumatic inoculation of the organism that has occurred. So I've understood why skin, because he's walking barefoot. But why verrucous? What do you understand by verrucous? Verrucous, verruca, what is that in dermatology? Verrucous refers to wart, right? So please remember, you see a warty cauliflower-like growth. You see a warty cauliflower-like growth which is right in front of you. You can see this warty cauliflower-like growth put up here. That is the reason you call it verrucous. So verrucous is also sorted, dermatitis is also sorted. What is the other name? Chromoblastomycosis. So yes, what is this chromo? Chromo means something to do with color, right? And I can see the color in front of me. What is the form that you're seeing over here under the microscope? We see the very famous copper penny bodies. The copper word is telling me that yes, there's a brownish color. That is why I called it chromo. So there is something called copper penny bodies, but I don't think the examiner is going to be that easy with you that he'll show you a copper color body and say that is this a copper penny body. He will tell you some other names. The other names are said to be sclerotic body. That's the next one that you have to know. Apart from that, we have something called the medullary body or the muriform body. So sclerotic body, medullary body and muriform body, these are the ones that you need to know over here. And obviously copper is the only name which is looking sensible because it looks copper in color, but examiner is going to ask you the other names.
Question 6. Which of the following is specifically found in gram-negative bacteria? Here are the options. A. Capsule, B. Peptidoglycan, C. Lipopolysaccharide, D. Flagella. And the correct options is C. Lipopolysaccharide. Here is the explanation.
You know, if gram positive, if positive had P, peptidoglycan, what does gram negative have? Gram negative is going to have lipopolysaccharides. What did I write? Gram negative has lipopolysaccharides. Can I indirectly say that the gram negative organisms have too much of lipid content? The gram negative organisms have too much of lipid. Think logically. If I treat lipid with alcohol, like I did, in which step? Come in and stain. I treated it with alcohol. Will alcohol dissolve the lipid? Of course. Will alcohol dissolve all that lipid? Yes. That is why the color also came out. I put alcohol and that entire lipopolysaccharide layer, alcohol melted away like alcohol, you know, like just melted all the fat like butter. Like all the lipid went out. That is why suddenly the color went away. Gram negative became colorless. And then which stain did I add to give it some color? I added some saffron in red. So basically I have made way for the red color stain. Entire lipopolysaccharide layer has basically gone off after alcohol. So I've given way for the second dye to come in, and that second dye is going to be saffron in red. I hope you've understood the physiology behind it.
Question 7. A patient presented with vomiting to medicine OPD. He has a history of eating fried rice. What is the most likely organism causing this? Here are the options. A. Clostridium perfringens, B. Bacillus cereus, C. Staphylococcus aureus, D. Bacillus anthracis. And the correct option is B. Bacillus cereus. Here is the explanation.
Bacillus cereus, C for C, that is, if they give you a history of Chinese fried rice, then they are referring to Bacillus cereus. That is going to be your hint in the exam. So milk, meat ke liye staph, and C for C, Chinese fried rice, cereus. Both of them have an incubation period of 1 to 6 hours.
Question 8. A 55-year-old man comes with complaints of fever and increasing fatigue for the past week. On examination, he is febrile, hypotensive, and tachycardic. The findings of the microscopic examination of his peripheral blood smear is given below. What is the causative agent? Here are the options. A. Plasmodium vivax. B. Plasmodium falciparum. C. Plasmodium ovale. D. Plasmodium malariae. And the correct option is B. Plasmodium falciparum. Here is the explanation.
Plasmodium falciparum, does this also have the same trophozoite, schizont and gametocyte? Yes. But please remember, this was also causing something known as cerebral malaria. Now, when this is causing cerebral malaria, it means some things are going to stick inside the brain vasculature. So remember, schizonts are going to stick in the brain vasculature. Schizonts will only be present in the cerebral blood vessels. They will not come out into your usual blood vessels over here. So will you see this in the blood? No. Remember, schizonts are not seen in blood samples. Good for us. Good for us, not for the patient. Good for us because I don't have to know the photo. Means for Plasmodium falciparum, I just have to know the photo for trophozoite and gametocyte, and that's about it because schizont doesn't come out in the blood. So how does the trophozoite look like? So Vivax ka ulta karo. Vivax was one ring, one dot, isn't it? So what is this trophozoite going to be over here? There are multiple rings. There are going to be multiple rings and there are going to be multiple dots. There are multiple rings and multiple dots that are noted. You can zoom in and see. See, you're seeing two rings. Two rings and they're having two dots. Some people start making their imagination run wild. They say, this is looking like headphones. This is looking like earphones. Yeah, you can use any of your favorite things that you want. This is definitely there. But imagine there are so many of them. For example, if too many relatives come into your house, there's some family function, these rings are your relatives, too many relatives come. There will always be that one angry uncle relative of yours who will mind some minor thing that I wasn't asked for a glass of water and will go and sit in one corner. Na? So most of you must have thought of that angry Fufaji's meme that always comes. Same way, when there are too many rings over here, one ring says, "Arey jaga nahi hai, I am going and sitting in the corner." That ring decides that I'm going to go and sit over here. It has gone and got stuck on the margin. So what is that known as? That is referred to as the acole or the applique form. That is referred to as the acole or the applique form. That basically means that there is margination of the ring. The ring decides that I'm going to go and sit in one corner. Okay, margination of the ring is going to be there. So remember, there are lots of rings when there are lots of dots, and apart from that, some dots got angry like a relative and went inside in the corner. So do you want to actually see the same thing that I've taught you? Look at this. Are you seeing like multiple rings in every RBC? Of course, lots, 2-3 of them. And are you also seeing multiple dots? Can you see like two dots everywhere? Yes. But can you see one ring is sitting at the corner? This must be that acole or applique form that I'm talking about. Acole or applique form is what we are seeing over here, that marginated angry relative. So trophozoites to ho gaya. Schizont to happy news, dekhna hi nahi hai. Now we come to gametocyte. Again, the story is the same. The microgametocyte will be given to the male and the macro word will be given to the female because females ko zyada importance. And what is the shape that you're seeing over here? The shape that I'm seeing over here is banana. Banana shaped gametocytes, male and female ka banana shaped gametocyte is seen.
Question 9. A 12-year-old boy is brought to the OPD with complaints of fever, ear pain, and difficulty in swallowing for 1 week. His jaw is shown below. What is the most likely diagnosis? Here are the options. A. Croup. B. Mumps. C. Infectious mononucleosis. D. Herpangina. And the correct option is B. Mumps. Here is the explanation.
What is the most common? You will say inapparent. The most common manifestation usually goes inapparent. If it has to show a manifestation, then the most common is going to be bilateral parotitis. That is the most common manifestation. That is why now you understand why Jerry had this cute little chubby architecture, because there is a bilateral parotitis. There's a bilateral parotitis that is noted over here. So now you will wonder something before I go on to the remaining parotitis. You will say that, ma'am, Right now, if I try to correlate the things, you told me that the infection is going to be via droplet or saliva droplet. So droplet means it's going to go into my lungs. If it was supposed to go into my lungs, how are you saying that the parotid gland is affected? Quite a valid thing if you had your logic going well, which most students shut down while reading micro. But if you have that logic going well, you should have thought about it, that why did that happen? So please remember, the mumps that is there, that is only going to multiply in the lungs. It is going to multiply in the lungs, and after that it is going to spill in the blood and go to different organs. It is going to go to different organs. So I can say lungs are only being used over here. It's use and throw kind of a thing. So they go into the lungs, they're going to multiply over there, they go into the blood, and then they're going to go to the parotid and to many other organs, which I'll tell you. And that is what. So this child is quite naughty, na? Child is never. So what does this child do? Child Jerry is playing in the lungs, and after that he says, I'm tired of playing. Children get bored very easily. So he says, I'm bored, I'm tired, now I want to go somewhere else. Goes into the blood and goes into different organs. And one of those organs is the bilateral parotitis. There is one very important clinical dictum that you see, that these patients can also complain of pain, and this pain is increasing on consuming citrus juices. It is increased on consuming citrus juices, right? Now I'll give you one clinical dictum which will help you a lot in surgery and other subjects also. Whenever there is a bilateral parotid gland involvement, you have to ask or look out in the question for two things. Number one, if it is a child, the infection that you are going to think of is going to be mumps, which is in front of you. If it is an adult and that adult has come out to be a chronic smoker, there is a salivary gland tumor that you have to think of, and that is a Warden's tumor. I am not saying that this is like 100% correct. This will definitely not be 100% correct in clinical practice, but MCQ में ठीक पक्का होगा, because clinical practice has variations. That's what the human body is. But definitely it's going to be a big savior when it comes to your MCQs. Bilateral parotid gland involvement in a child is going to be thinking of mumps, and in an adult smoker is going to be thinking, you're going to be thinking of the Warden's tumor.
Question 10. A patient presented with complaints of fever for 3 days and general fatigue. On examination, splinter hemorrhages were seen. Echocardiography revealed vegetation on the valves and thus a blood culture as done. The organism in the culture was seen as cocci in chains that showed alpha hemolysis on blood agar and was resistant to optocin and bile. Which of the following bacteria is most commonly implicated in this condition? Here are the options. A. Streptococcus pyogenes, B. Streptococcus sanguis, C. Enterococcus, D. Streptococcus agalactiae. And the correct option is B. Streptococcus sanguis. Here is the explanation.
What does sanguis cause? Sanguis is important for prosthetic heart valve endocarditis. So sanguis is going to result in the prosthetic heart valve endocarditis.
Question 11. Safety pin appearance is seen in? Here are the options. A. Haemophilus influenzae, B. Burkholderia pseudomallei, C. Pseudomonas aeruginosa, D. Burkholderia cepacian. And the correct option is B. Burkholderia pseudomallei. Here is the explanation.
Microscopically, you see the safety pin appearance. Another name for safety pin appearance, I told you, it looks like this. This means it is a bipolar staining. Safety pin appearance refers to bipolar staining, and I've got you all the organisms in microbiology that show you that. So for that, all of you will have to make a safety pin, and I have no mnemonic because I think by now you are sick of mnemonics. Our ABCD has also stopped working, hai na? So now how will you learn it? So let me see. From one end of the safety pin, can I make a Y? Yes, Yersinia pestis. Can I also from the bottom make a V? So that is going to be Vibrio parahemolyticus. Okay. From here, can I end up making a D? So Haemophilus ducrei. From the D, can I make a B? All the Burkholderia malai, Burkholderia pseudomallei. And finally, we have that I can make, dissect it and make a K. And that K means Klebsiella granulomatis. Remember I told you the Donovan bodies a while ago? Exactly. So do you want to do this? A lot of drawing that I've done. So pehle in the exam, make a safety pin. If you make a V out of it, it is Vibrio parahemolyticus. If you make a Y out of it, it is Yersinia pestis or plague. If you make a D out of it, Haemophilus ducrei. You make a B out of it, Burkholderia malai pseudomallei. And you make a K out of it, Klebsiella granulomatus. Bus fill all the lines, practice this once on your own and you are sorted. These all show you the safety pin appearance, but now the question comes is, what is the stain used for knowing this safety pin appearance? Most importantly is the Vasen or the new methylene blue, also the right or the Giemsa stain.
Question 12. Identify the parasite. Here are the options. A. Giardia lamblia. B. Trichomonas vaginalis. C. Trypanosoma. D. Cyclospora. And the correct option is A. Giardia lamblia. Here is the explanation.
So of course the next question will be, how does the microscopy come across? Of course you will see one trophozoite, and now comes the story of the angry old man. So please note, these are the pictures that you have to know. What you have over here is the very famous trophozoite of Giardia lamblia, and what you have over here is the cyst form. Can you identify which form is this? Pehle to organism, you will say, this I'll never forget, the grand old man, the grand old angry man of the intestine. The man will tell me that of course there are two nuclei, so ye wo grand old angry man hai. And apart from that, you can see some flagella, that beard also coming out. So this is definitely the trophozoite form. Whether you saw it in the stool sample or you saw it in the duodenal sample, this is the trophozoite form that you had.
Question 13. The egg shown below belongs to. Here are the options. A. Hookworm. B. Whipworm. C. Pinworm. D. Roundworm. And the correct option is B. Whipworm. Here is the explanation.
The very famous egg of Trichuris trichura. So what does it look like? It looks like a barrel. Okay? And if you look very carefully, brown color ka hai, matlab it is bile stained. These are gonna be bile stained eggs, which are very important for you to know. They are bile stained and they are barrel shaped. They are barrel. So many students say, ma'am, barrel shape and all is like too hi-fi English. Simply dholak ki tarah lagta hai. It looks like a dholak, right? Dholak, that musical instrument, it looks like that. So yeah, it is a barrel shaped egg, but dholak also has two ends, na? Like over here, one end, and over here, one end. Yes, it is a barrel shaped egg, and at both the ends, it has the mucus plugs. And remember, these mucus plugs are not bile stained. If you look at the ends carefully, they are not brown in color. They are a little transparent. So the mucus plugs are not gonna be bile stained. Repeating all of this once again, the surface is gonna be bile stained, but the mucus plugs are gonna be non-bile stained.
Question 14. What is the average incubation period of Plasmodium falciparum? Here are the options. A. 12. B. 14. C. 30. D. 28. And the correct option is A. 12. Here is the explanation.
Everything, let me tell you, for vivax and ovale is always going to be similar, 13 to 17 days. Everything for vivax and ovale is going to be similar in the story. So 13 to 70 days. Now falciparum is going to be fatafat. Fatafat is going to be 12 days. So it's a little shorter than vivax and ovale. Then we have malaria. Malaria is going to be a very lazy one. Lazy one matlab it's going to take 1 month. So remember, malaria ko month lagta hai. Malaria ko month lagta hai. And knowlesi, to knows it all. Knows it all means it's going to be even faster. Knowlesi knows it all. So it's going to be a very less incubation period of 8 to 10 days. Dobara karte hain. Vivax and ovale are friends. Everywhere you will see vivax and ovale are going to be friends. 13 to 17 days. Falciparum thoda sa fatafat, 12 days. Knowlesi knows it all and is going to happen very less incubation period time hai, so 8 to 10 days. And this malaria is going to take 1 month, okay, 28 to 30 days. And what is the incubation period? The liver and the RBC, dono ka schizogony I have combined.
Question 15. Sporulation occurs in which phase of the bacterial growth curve? Here are the options. A. Stationary phase. B. Lag phase. C. Log phase. D. Decline phase. And the correct option is A. Stationary phase. Here is the explanation.
Now we move on to the stationary phase. The bacterial count has come to a standstill. Okay, so before I start with this, I want to ask you something. So for example, you were planning to do a gram staining. Okay, you were planning to do a gram staining in the previous wala also. You say, ma'am, in the previous one, all the bacteria were dividing. Dividing means they were living. No one's dead, na? All the bacteria are viable. when all the bacteria were viable, this means that on gram staining, I was going to get a uniform stain, right? I was going to get a uniform stain as all of them were living. But now as I enter this stationary phase, I will realize that some of the bacteria have basically remained viable and some of them have started dying. That is why that plateau has come. Some of them are going to remain viable, some of them are not going to be viable, so I will not get a uniform staining. Now all of them are not alive, all of them are not going to pick up the gram stain, so some will be picking it up, some will not be picking it up. So now my staining becomes non-uniform. So why has that happened? Why have you reached that plateau? Because obviously guys, till how much time will you be able to work? After some time you will get exhausted. This means that the bacteria has had depletion of nutrients, the bacteria has got exhausted, and that is why the plateau has come. So now there are some living, some dead, and non-uniform staining will come. And the mnemonic for this particular phase is, you call it stationary na, so stat ka I'm gonna make it stab. It is a stat stab. Stab means what? If someone asks you sporulation occurs in which phase, S for sporulation, T for toxin production, which toxin? Of course exotoxin. A for antibiotic production, B for bacteriocin production. So remember, if you are asked in the stationary phase, sporulation, toxin production, antibiotic production, bacteriocin production, these four things are gonna happen in the stat stab phase. Very, very famous questions that you have, right?
Question 16. When should you perform Vidal test in a case of typhoid? Here are the options. A. First week, B. Second week, C. Third week, D. Fourth week. And the correct option is B. Second week. Here is the explanation.
How will you do the diagnosis? And there's a very, very famous mnemonic called BASU. How have we divided BASU? That is depending on which week the patient has come to you. Week 1, 2, 3, 4. So please note, in week 1, you would prefer to do a blood culture. In week 2, you would want to do an antibody test. An antibody test is known as a Vidal test. In week 3, you would want to do a stool culture. And in week 4, you will want to do a urine culture. But guys, this is very, very strict. It's not that 7 days, 14 days, 21, not like that. Yes, there can be an overlap. Antibodies can come in by early days also and can persist longer. Stool culture can come positive earlier also. This is just a way of learning.
Question 17. Hemolytic uremic syndrome is associated with. Here are the options. A. E. coli 0157 H7, B. Malaria, C. Parvovirus B19, D. Bartonella henselae. And the correct option is A. E. coli 0157 H7. Here is the explanation.
Hemorrhagic E. coli. So the word is only telling me that some hemorrhage word is going to happen. This is the most common cause of hemolytic uremic syndrome. And number 2, this is also going to cause another hemorrhagic thing, that is hemorrhagic cystitis. So you will obviously wonder that why is it causing so much of hemorrhage wala thing? What is the point behind it? Remember, this is associated with two things. Sabse pehle, it is associated with the verocytotoxin or the Shiga-like toxin. That is one thing that you have to know. Secondly, it is associated with a strain. Listen to me very carefully. O157H7. It is associated with a strain called O157H7, and that is repeated 5-6 times. This is the most important. O157H7.
Question 18. DNA transfer in bacteria via phage is? Here are the options. A. Conjugation, B. Transduction, C. Transformation, D. Translation. And the correct option is B. Transduction. Here is the explanation.
Transduction. What do I need for transduction? What is this tadpole shape thing that we have over here? So this tadpole shape is referred to as a bacteriophage. This tadpole shape is referred to as a bacteriophage. Not only tadpole, it can have many shapes. It can also be circular, it can also be filamentous, but what we most commonly study is going to be the tadpole shape. But what is it? I'm calling it a bacteriophage. Is it a bacteria? No. Bacteriophage is a DNA virus. So you are saying that, ma'am, for one bacteria to give material to another bacteria, you need a virus? Yes. If this hand is one bacteria, this hand is another bacteria. Bacteria, they want to transfer things between them. Whom are they going to use? Virus. So can I say bacteriophage will pick up something from this bacteria, deliver it to this bacteria? So bacteriophage is nothing but it is one of your food delivery apps. It is picking up the food from the restaurant, giving the food to the client, and that's about it. So that is exactly what we are going to do in transduction. Remember your Swiggy, Zomato, that is what is transduction. That is what is a bacteriophage.
Question 19. Yaws are caused by. Here are the options. A. T. pertunae, B. T. pallidum, C. T. caritum, D. Haemophilus. And the correct option is A. T. pertunae. Here is the explanation.
Then we have Pertenue and Cariatium. So remember, P is not for P. Again, if you by now have studied Path and Micro with me, you know that my favorite mnemonic and somehow that fits everywhere is P is not for P. So that means that if they ask you who is causing Pinta and yaws, so P is not for P. Pertenue is causing yaws and Cariatium is causing Pinta. So remember that P is not for P. Repeating, Treponema pallidum, everyone knows sexually transmitted syphilis. Endemicum, endemic syphilis. Treponema pertenue doesn't cause Pinta, it causes yaws, and Treponema cariatium causes Pinta.
Question 20. Which bacteria shows a Quelling reaction? Here are the options. A. Pneumococcus, B. Gonococcus, C. Streptococcus, D. Staphylococcus. And the correct option is A. Pneumococcus. Here is the explanation.
Next, we have a testing called Quelling reaction or Neufeld reaction. Like for example, we are doing it for Streptococcus pneumoniae. You can do these for any capsulated organism. I'm giving you most important examples. So Quelling, I have rhymed it with swelling or swelling. Quelling will remind you of swelling. I'll tell you how. For example, if this is a bacteria and all of you are saying that I'm talking about capsulated bacteria, so can I say that every capsule will have an antigen around it? And if there's going to be an antigen, I think this much everyone knows that if I add an antisera or an antibody to it, there will be a reaction. There's an antigen-antibody reaction that is definitely going to take up over here. Will that result in the swelling of this capsule? This capsule will end up swelling. That is important. So please note that when they talk about swelling of the capsule, they are talking about which reaction? Swelling for Quelling. Easy. And I also call it the Neufeld in how I have learnt it is fela hua capsule. Okay, so Quelling is gonna be the swelling of the capsule and the Neufeld means fela hua bigger capsule.
Next up is dermatology. Do join us tomorrow to experience a fun learning journey. Hit like and subscribe to stay connected with our enriching content. See you in the next one.